Hi, welcome back. Today's guest is James Farese with ReachLink. It's a telebehavioral healthcare company out of Boca Raton, Florida. James, thanks for being here.
Thank you, Bob, for having me. I appreciate it.
So this is, I love what your company does. I think your mission and what you do is so incredibly important in our society today. So quick, give us an overview of what your company does and kind of how you got to now.
We're an online telebehavioral health platform. We, in essence, connect licensed mental health therapists with people looking for assistance with issues like anxiety, depression, workplace stress, relationships, etc. Our platform is entirely talk therapy based. We don't do any medication management, so there's no psychiatry component. Um, the 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 types of cases we typically treat are more general mental health cases. So we're not dealing with SMI, severe mental illness, or cases that involve like a complex medication component. It's really more for people that situational depression, anxiety, maybe going through something at work or something in their relationship and they need some guidance or help or strategies on how to cope or get through that. Um, how I got here, so my career in behavioral health started a little under 10 years ago in the substance use treatment field. So I was a partner in a brick and mortar facility that treated people for substance abuse issues. And in 2018, I started looking at telehealth as a way to connect members that have just done a 30, 60, 90-day episode of care, in-person treatment, inpatient treatment, looking for a way to keep them connected with the provider that they had just built some rapport with, right? So typically at that point in your life, you're changing all the people, places, and things in your life, and you're looking for people that can kind of help guide your path. And oftentimes it's that therapist, that provider that you just spent working with while you were in treatment. So that was the original thesis, is just to try to extend the continuum of care, or at least just stabilize that transitional process from institutional care back to wherever or to wherever that person was going. And launched in early 2019, originally just intended to be kind of a boutique aftercare solution for people discharging from treatment centers. About a year to the month after we launched, COVID happens, and it stuck around a lot longer than we thought it would. And fast forward to today, we built our own proprietary tech application. We have over 300 providers on our platform. We're in network with all the major payers nationally: Cigna, Aetna, United Healthcare, and some other ones. We treat over 5,000 cases a month, and we're growing. And we've really kind of, in terms of like differentiating what we do, we've really focused on the provider experience. We think a positive member experience is downstream from a positive provider experience. And so when you think about our model, if you compare it to something like Uber, the provider kind of signs in, does the session, signs out. We handle everything else. So we do all of the insurance interface in terms of credentialing their contracting the provider, billing the insurance claims, claim follow-up, customer service with the member. We built a lot of clinical tools that help the provider write their notes faster and more efficiently, and we do a lot. So really what we try to do in essence is we try to take all of the administrative work out of being a provider so that the provider can just focus on what they went to school for and what their passion is, which is being a great provider. When you're in private practice as a provider, you're doing marketing, you're doing accounting and bookkeeping and all these other things, and that takes away from the time spent with the actual client. And so we try to free up the provider from all those administrative tasks so that they can focus on just doing what they are good at and passionate about, which is delivering high quality care.
So I was a little bit impressed by when I read through all of the things that you're doing, and then you described the level of what you do to take care of the providers on top of providing top-notch mental health care to people in need. And now I'm way impressed. I really love how you package that to make it easier for the provider to do what they're best at. I think there's a lot of businesses out there that have a particular expertise, whether it be therapy, coaching, or providing accounting services. It doesn't matter what those services are. If you want to own your own business and work for yourself, you spend more of your time dealing with the insurance companies, dealing with the marketing, dealing with client acquisition. So if you can take that away, that burden away from the providers, so that they can concentrate on their superpower, which is helping their clients, you're providing an incredibly valuable service, not just to the clients themselves, but for the providers to make everybody's life a little bit easier. So, wow, well done, you.
Thank you. Thank you.
That's
It's
awesome.
it's been a long road and a lot of blood, sweat, and tears, but we're really fortunate to be in a position where we can help a lot of people, both providers and their mission, and also people looking for help with things that they're struggling with.
I absolutely applaud when you say we want to focus on the provider experience, and that goes downstream to help the clients. And you're right. If they're not distracted by, hey, I still haven't talked to your insurance company yet, so I'm going to be distracted during our session. No, James has got that for me,
Right.
so I can concentrate on helping you and not worry about it. That's fantastic. What do you think the biggest challenges are going forward, kind of in your industry and your business in particular?
Yeah, so I've talked a little bit about this before in the past, but I think a big bottleneck in the industry right now is just is access. Right, there's our market is very large, somewhere between 60 and 90 million Americans, and when you look at the number of providers that are out there practicing, if you combine probably the four biggest networks out there in terms of provider networks, you're talking about 20 to 25,000 clinicians in aggregate across like the four biggest provider networks. And that's telehealth provider networks. And so when you think about it, you're talking about a very large group of people seeking care and a very small group of people that are qualified to offer the care. And so it creates a lot of disparity there. And so I think the challenge is, outside of just, we need more providers coming into the industry. I think ways that telehealth platforms can create efficiencies in their provider networks, faster access to care, more streamlined insurance operations, clinical efficiencies to decrease episodes of care. So how do you reduce a treatment episode from 15 sessions to 10 sessions, right? Or anything that can be done to create efficiencies in these networks while still maintaining high clinical output, I think is really really hard. But where the value is, and those are the challenges that I think we and a lot of the companies out there are facing right now, is just making sure there's enough supply to keep up with demand, so to speak. And when you're doing that, the business model is very simple, right? Connect two groups of people together, right? But when you think about like even our business, which is a growing, but we're definitely not the biggest platform out there. We deal with 66 different insurance companies every month. We're scheduling people across 8 different time zones. We're dealing with regulatory policies in 50 different jurisdictions, right? There's a lot now that comes into it, right? So what's a seemingly very simple solution, connect person A to person B, there's all these checkdowns and filters that you have to go through, and building the software that can enable those connections efficiently and compliantly, while not having to increase headcount every time you reach another keystone in the business. It's really, really challenging to do. So conceptually, I think when I'm explaining this to people, it's really easy to grasp the concept. When you're actually in it and you're building, there's all these nuances that you never think about that we deal with on a daily basis. And like I said, every time you achieve a new keystone, there's a different challenge at each level. So, like I said before, very blessed to be an opportunity where we can help people, but there's a lot of complex, especially in healthcare, and we're relatively, our version of our vertical in healthcare is relatively easy compared to something more complex where maybe the insurance requires prior authorization, or there's multiple interventions that need to take place in a certain sequence. There's just a lot that goes into it. So I think the main thing is just access, and then after access is all of these kind of logistical nuances that you deal with, that I don't think your average person visiting your website even understands that you're solving for.
Yeah, that's for sure. Everything is simple on the surface, right? And then as soon as you scratch below that, you start to realize how difficult some things can be, and the hurdles that are there that are often unseen. And frankly, your clients and your providers don't care that you have to solve for them. They just want it solved.
Right.
And so there's a underappreciation for how difficult your job is, and I'm sure that uh, there's often a conversation about, hey, what am I paying you for? Aren't you just supposed to connect me to somebody, either a provider or a client? It's like, yeah, there's a lot more into making that connection than what looks like on the surface. This isn't calling for an Uber,
Mhm.
right?
And that's a good point too, because what we've found is what's really effective clinically for people seeking therapy is who they're connecting with as the provider. So we've found that if it's really hard to build rapport with someone, right? If you don't respect that person for whatever it is, right, or you don't connect with them or identify with them for whatever that reason is, and that's not always a negative thing. It just people gravitate towards different personality types, or maybe it's a language thing, or whatever. We found that the better that connection is on the front end, the better the clinical output is long term. And so we spend a lot, after all like those business logistical things, we spend a lot of time asking the client kind of what they're looking for in terms of a provider, because if there's some difference that for whatever reason causes you not to be able to connect or build rapport with that person, even if that provider clinically is the best provider out there, if that member can't connect with them on a human level, then we see a lot of degradation in the quality of care, or
Right.
outcomes from the care. And so that's another piece too, which is totally disconnected from the business logistics. It's really more of the, I guess you call them human logistics, where we're trying to make sure that match is the
Yeah.
right match on the front end. And so that's another piece too, which you kind of hinted on, that I think is really really important when you're connecting people, right? Like you said, if it's an Uber, I just want to get to point A to point B. This is so much more personal than that, and so we really spend a lot of time making sure it's not just a fit from like a business perspective, but also a fit from a human perspective.
That's incredibly important. And I think you talk about the numbers, 60 to 90 million people that are in need of some sort of telehealth, mental health care, uh, but only an order of magnitude less in terms of providers. So how do you find providers? How do you qualify them to be a provider within your network?
Yeah, so there's a number of things. A lot of the insurance networks that we work with have their own thresholds, so that's kind of the minimum threshold. Is they have to be licensed in the state that they're practicing. They have to have certain insurance requirements. Oftentimes, there's a certain experience requirement, typically 2 to 4 years of experience, unsupervised. So there's those kind of like basic regulatory or quasi-regulatory standards, and then we're really looking for people that demonstrate an ability to, like, it's kind of normal business logistics, right? Like, are these providers, even though they're independent, they still represent a collective, and so when someone shows up to a session, for example, they expect the provider to be there on time. They expect a certain level of attentiveness during that session, which can be difficult to convey via screen, right? If you're in person, you can read body language. It's different, right? So there might be things that are quote unquote lost in translation when you're doing it, delivering care virtually. And so we're looking for people that have some technical abilities or technical experience in terms of delivering telehealth. We're looking for people that, again, meet the kind of minimum clinical or regulatory criteria, but then also just people that are looking to, um, be committed to the platform long term. Right, a lot of our providers have their own private practice and supplement the work with what they do. Sometimes they're on multiple platforms along with ours. Sometimes they're on one platform in their private practice. So we look for people that want to have a certain level of commitment in terms of the amount of hours they want to contribute on like a weekly or monthly basis. And then from there, those are kind of like the minimum thresholds. And then we built a lot of technology to kind of help the provider self-assess as they go. So we send surveys to the member, clinical surveys to the member after each session to grade clinical outcomes. So we can kind of we can kind of convey to the provider, hey, here's how your caseload is performing clinically. And so and then we start to look at things like that. Which evidence-based techniques are they using? What kind of outcomes are they generating? How can we improve that? And so we're really looking for people that are also committed to self-improvement as well. We don't spend a lot of time training or coaching on that. It's really more of an analytics that we provide to them where they can kind of self-assess and improve. And
Right.
so we're looking for people that are just committed to that process. And some of that takes time. Like some of that, you need enough data to be able to convey that. And so once they kind of get to a certain saturation level of data, they can begin to self-assess, and we can continue that relationship of improving over time.
That's awesome. So obviously, in building this thing, you've had to overcome a ton of obstacles, and every state's a little bit different. So the obstacles in each of the states that you expanded into has probably presented its own challenges, as well as dealing with multiple different insurance companies and their networks that have their own sets of bureaucratic stumbling blocks that have been presented to you. So tell me about a couple of the biggest obstacles you've had to overcome, and what is it about you and your leadership team that helps you overcome those obstacles rather than be defeated by them?
Yeah, so I think they've been different challenges at different phases in the business. So kind of early on, we started with off-the-shelf software, and we migrated to a different off-the-shelf software a number of times. And we found that we kept building the workflows around the software instead of the software around the workflows, because the workflows in this industry are really important in terms of creating efficiency. And so a couple years ago, we decided to build our own technology platform because we're getting to a point where the vendors that we were working with, when you're building a SaaS company that's selling this type of software, you're dealing with multiple customers and you're trying to find a solution that can benefit all of your customers, right? And when you have a company like ours, we're building a very kind of building towards a very specific endpoint. You need more customization, and so that was a challenge early on. Is kind of the process of just building out that software, and it took us a few years to kind of get that right, just in terms of getting the provider experience correct, getting the member experience correct, getting also the admin experience correct. So our team that are actually working on the platform, helping to coordinate care. So it took a little while to get that correct. I think that was a challenge for a while. During COVID, recruiting was an issue. Therapists were in such high demand that it was really, really competitive. And so even though on paper it sounds like, hey, COVID must have been great for you in terms of demand, you have to still capture a certain amount of supply in order to meet that demand. So that was a challenge during COVID. And I think today it's more about really being able to continue to scale at the rate we've been scaling. So the market opportunity is definitely there, but now we're dealing with as we contract with payers, there's certain for like example, billing operations, right? We're fee for service right now. We're starting to move into value-based care, which is great in terms of operational efficiency, but you really have to kind of understand your data and your clinical outcomes in order to be able to present what you're doing in a way that payers can understand. And so now it becomes more of a data exercise in terms of understanding your own data so that you can convey what you're doing and how you're doing it and why you're doing it. So again, that's just a few of the kind of hurdles that we've kind of overcome. In terms of the leadership team, I think we take a really entrepreneurial and collaborative approach to problem solving. So we're coordinating a number of different kind of departments. We have our care coordination department, which is kind of responsible for client sign up. We have our recruiting department, which is onboarding providers. We do software development in-house, and so all the solutions that we build for our software are all done in-house. We don't outsource that. All of our lead generation is done in-house. And so when you're coordinating, for example, which states you want to target for recruiting, you really have to look at your marketing data and sign-up data to understand, okay, which states do we need to double down in? Where are we seeing more demand that we need to coordinate to hire more recruiters? Or when you're taking all those departments and you're building internal tools, software tools, conveying that in a way that the software development team can understand to build the most effective solution becomes really important. So it's really more, I think, it's an exercise in logistical and operational efficiency, and building. I think it's really building the processes around how, because every time you reach a certain kind of growth milestone, your systems and processes break, and then you have to build new ones. And so it's really more an exercise of kind of understanding why things are breaking, being able to devise the new solution that's the correct solution, and then even though that might be the right solution, you still have to implement and execute on that solution. And so being able to keep that same level of collaboration while still growing the business, it just becomes the easiest way I can say it is a logistical exercise in operational efficiency, and how we approach that, where everyone kind of feels like they're a stakeholder. There's a lot of meetings where there's disagreement and we're hammering things out, and we stay in the room until we get to the solution. But I think that's important as you're solving really complex problems and also creating buy-in from your team. And so it's really a collaborative effort in terms of identifying what the problem is, identifying what the correct solution is, making sure there's buy-in to that solution, and then actually executing on that solution. And I feel like every quarter that's a completely new exercise that we do from scratch.
Well, I think that's, living in a 90-day world, 90 days is somewhat predictable. Anything beyond that is really just speculative. And so if you're dealing with the toughest issues in front of you as a team, and you have one person that's integrating all of those different functions, then you have a recipe for success. And if you're trying to implement something that's a 5-year thing, and let's just keep that long-term goal in mind, that's great to have a vision, but you live in a 90-day world. And so I love the way that you're talking about collaborating across the different functions that take place in there, because that's a key. You can't have recruiting out in front of demand. You can't have demand too far in front of recruiting. You can't have operations outrunning your sales. And if you don't have admin and finance sorted out, you're not going to pay your bills or your providers and get your accounts receivable taken care of. All of that stuff has to function together as a management leadership team, and it sounds like you've got a great recipe for it. So that is awesome. Listen, I love what you do. I think it's very timely in the marketplace, and I hear what you're saying about COVID being difficult in terms of recruiting, but I think the cultural shift within the country of, let's recognize that we have a mental health issue. Let's get rid of the stigma of asking for help. Let's be willing to connect with providers who are willing to help us through those problems. And then let's leverage technology to be able to connect with those things. I think that you've combined all of those things together into something that's a winning recipe. And then to put together the infrastructure, the processes, and the right people in the right seats is a fantastic recipe that is going to serve you incredibly well in the coming years. So kudos to you for that.
Thank you. I appreciate that. I really do.
Awesome. So quick, tell us how people can contact you, whether they're a provider who wants to become part of your team or if they are a client that is looking to connect.
Yeah, so the best way is probably our website, reachlink.com, reachlink.com. There's pathways to sign up there. You can also call in if you want someone to help kind of walk you through the process, whether you're a potential provider or a potential member. Our care coordination department is really well equipped in answering questions about insurance, therapy in general, kind of what the offering is, what to expect, which is, I think, a unique selling point a lot of other platforms don't offer. A lot of them, it's digital only. And so we really are excited about the fact that we can offer that, where you can actually call in and speak to a live human that can walk you through the process. So that's probably the best way if you have more questions, or if you just want to learn more, our website is reachlink.com.
Fantastic. Well, thank you so much for being here today. Our guest has been James Farese at ReachLink. And if you need to get in touch with him, at reachlink.com is your best place to do that. And listen, if you need help, get help. And this is a great place to get started. And if you're a provider out there and you're looking for a way to connect with clients in a way that's going to be advantageous for both of you, hop on reachlink.com, get a hold of James, and you'll be off to the races. James, thanks so much for being here.
Thank you, Bob. I appreciate it.